Okay, I've just finished packing my clothes. I'm going to pack the little one's clothes here, and then also pack the medications. So for her, all the syrup, the flu, the cough, the fever medicine. Then don't forget the adult medicine also, plus the inhaler are packed inside, and also a few ART kits for standby. Then I also packed the first aid kit. Inside I have the creams and the plasters. Okay? Is there anything else that I missed out?
Hi everybody, this is Dr. Lee and Dr. Zhang from Paddington Medical. What we're going to share with you today is tips for healthy travels with the family. It's actually a travel guide for traveling healthily and safely. So why are we doing this? Just like you, we are parents too.
You'll probably be traveling soon and you'll be caught up with all the pre-travel planning and all the packing. But we also know that nobody wants to fall sick on a holiday. But as you know, as for kids, right, when they fall sick, it's always unexpected, and always expect the unexpected with children.
Okay, so before you travel, here is some recommendations that you might want to consider. So anticipate and prepare. This is before booking the flight. When you're actually considering a flight, do a good seat selection. For babies, you might need a bassinet seat. That means it's like a little basket that's in front of the seat itself, and then you might need to put your baby inside there for a certain portion of the flight. Also, you might want to choose a seat near the galley or the toilet for kids to go to the toilet quickly. Because if you're choosing somewhere in the mid cabin, then you need to rush to the toilet sometimes. Also, our seats are a bit dangerous for toddlers when food trolleys pass with hot drinks or hot food. So you might want to consider maybe putting your younger one, in between you and your partner. Okay, so or maybe give them a window seat because kids like to look out the windows and to look at the nice scenery outside. Secondly, pick an early morning departure. It's usually less crowded, and sometimes you can adjust for time zone changes also. The last point is overnight flights can be quite challenging for kids, especially red-eye flights. You switch time zones and then you land in a different hour, and then the sleep cycle goes a bit wonky, and the next day can be quite a trouble for you also.
Okay, so let's move on to what to pack before the trip. So, okay, a few things. So, of course, before you start packing, explain to your child that you're traveling, and if they are of the appropriate age, they will definitely be excited. You can even get them involved in the whole packing process. So just for regular things that you need to pack for kids will be the usual things, clothes and all that. But in addition to that, always remember for children there are extra things you need to bring along. Like for example, wet wipes, Ziploc bags, plastic bags. You never know when they're going to poop or they're going to vomit or do something that you don't expect. And also remember to bring enough clothes. Always bring, it's probably safer to bring more than to bring less, especially if you're going to cold countries. Also, don't forget toys or anything to basically keep them occupied and entertained. And also for periods of time where you're worried about them catching flu or anything like that, remember to bring along disposable face masks, especially on the flight where everyone is quite close together, is sitting quite close together. Okay, also let's move on to the next point, which is the medication packing list. So for us, this is actually quite important because you really never know when you'll fall sick. For yourself, if you do pack or you do not pack, it's fine. Sometimes you can get medications overseas, but for children, it can be quite a hassle. So some common things you might want to bring along for your child will be medications that will help to treat like the common flu, stomach flu, food poisoning, because these can be easily obtained, as opposed to going there and trying to struggle to find these medications. Also, if your child has any existing conditions, like for example, asthma, eczema, any sensitive nose issues, remember to pack medications for this, especially if you're traveling to a different country with different types of weather changes, you might expect these things to happen. So if let's say there are specific medications that they need long-term for any of their long-term medical conditions, then also remember to bring along a doctor's letter about the medications in case it's needed in the airport. Also, this is optional. You might want to bring along ART, antigen rapid test kit results if you're worried about catching COVID overseas. So apart from that, do not forget this also. Children tend to run, tend to play, and they can get injured when they're overseas. So remember to bring along a first aid kit, plasters, creams, or whatever is necessary in case they do injure themselves. Remember to see your doctor to discuss more of what medications are suitable for your child. Okay, so so like I mentioned, these are the common these are the common types of medications we do give for these conditions. Mostly it's antihistamines for runny nose. If it's blocked nose, we might give decongestants. Cough suppressants for cough, and fever medications are also important because if they have fever, it can be quite difficult to manage overseas. As for sore throat, generally these are a bit more difficult for younger kids. So instead of giving lozenges, which is not safe, we usually recommend to give them cold things to suck on, which will help to soothe the throat. Okay, as for diarrhea or food poisoning, so sometimes we like to give medications that double up for both cough as well as vomiting, so that there are less medications you have to bring. Rehydration salts, which come in packet form, which is quite easy to transport. Probiotics is also quite important. In fact, you might want to consider giving your child that on a regular basis, even during the trip. And something for stomach ache if the child is complaining of pain. And don't forget to bring along their favorite snacks as well.
Okay, so just before flying off, here are some of our recommendations. Number one, get the appropriate vaccinations done. Influenza vaccination, or the commonly known as flu vaccine, is not only a travel vaccine. Actually, you should consider doing at least once a year based on current guidelines. But the main things that most people think that you should just do it just before you fly off. Yes, that is that is correct to a certain extent. You probably should get it done about 2 weeks before flying off for your trip. Okay, because the body needs some time to build up the immunity. However, it is really not the only travel vaccine. There is this website called the CDC website, Center for Communicable Diseases. It's an American website, and it provides guidance on country-specific vaccinations. I will highly encourage you to see your doctor early to clarify what vaccines are needed and what kind of preventative health measures are needed before you go for this trip. So cater at least 2 to 3 weeks prior to get all the vaccinations done, just to make sure that you have enough immunity before going for the trip itself. 1 to 2 days before flying off, if your child is sick even with just a simple runny nose just before flying off, it's actually a good idea to check in with your doctor first, because sometimes this kind of respiratory infections actually has a spread to the ears, and sometimes the ears get a bit blocked also, and this affects their flying experience because they may get a bit of ear pain during the flight itself. And just do check your carry-on luggage. Make sure the medication quantity is safe and permissible to bring on board, less than 100 ml. That's the current law for the syrups to be brought on. And also get to the airport early to clear immigration.
Okay, so some things to think about during the flight itself. So generally, of course, when you first enter the flight, the first instinct now will be to wipe down everything, which is the reason why I mentioned to bring along wet wipes, because expect your child to touch everything on the seat, basically the screen, the aisle, everything. Okay, so remember to wipe everything down. Okay, a few things to look out for during the flight itself. So children, depending on their age, will experience ear pain, and they do not understand it. I mean, for the older ones, they can complain of ear pain. So especially during right before takeoff and descent as well. So usually for these instances, I will recommend that you let your children use headphones instead of earphones, because earphones might be uncomfortable and might actually push any existing earwax into the ear and make the whole experience even more uncomfortable. Also, a few other things. Some children can also get motion sickness. So if your child has a tendency to have this, remember to book a window seat for him or her, and also try to avoid large feeds on the flight. Just give them snacks unless it's a very long haul flight. So during the flight itself, keep the kids occupied. Bring along things that basically they like to play with, or their comfort items, especially for younger kids. So toys, books, and snacks for toddlers, activity kits for preschoolers, and also allow some screen time during the flight as well. As much as possible, of course, we will suggest to keep the mask on for your child as much as possible, and stand by some more disposable ones in case they get wet during the flight.
Okay, so during the trip, some travel tips if your kids actually do fall sick. For fever management, most commonly we use, unless you have a drug allergy, we usually use paracetamol and ibuprofen. I mean, as parents, we kind of know them as the pink syrup and blue and orange syrup. So we actually alternate that paracetamol and brufen 3 hourly. But of course, discuss with your doctor to refresh your memory if you forgot how to use this. So the next point is about hydration management. If your child has reduced intake, which means vomiting and things like that, cut back on the milk quantity a little bit and maybe feed a bit more frequently. For flu, if they have a runny nose, a bit of cough, try to give them some medications before the meal and sleep so they can eat and sleep better. Okay, so for rashes, for some rashes, if you're traveling to hotter or colder countries and your kid has sensitive skin, make sure you bring along the relevant moisturizers and the relevant creams that you have. But of course, discuss with your doctor first because I'm sure your doctor will know more about your child's condition. Next thing, take note of when to bring to see a doctor, even when overseas. If your child has failed self-medication, if the fever is very difficult to control, and if your child is having fits, poor hydration and appetite, and less than half the usual amount, and the urine and the poo significantly reduced. If any of these things happen, or if you have any parental concerns, try to find out from the locals at the area that you are traveling to, the nearest location to see a doctor. But of course, maybe sometimes the hospitals may be a bit better and more appropriate for your child's condition. Most importantly, remember to enjoy the trip. And Paddington Medical
wishes you and your family safe and healthy travels. Thank you.